So literally every single person that I have talked to or asked or seen talking about the NCE has mentioned that there is a ton of questions on group counseling. So let's learn all about it. So let's start off with what are the benefits of group counseling. So you have a place where you can feel safe and share your experiences. You have diverse perspectives, which leads to diverse people sharing their experience as well as sharing their communication styles, so you can see the behavior and in turn model that behavior. You're fostering resilience through group skill building, going back to that communication style, going back to being able to confront someone in a group setting and in a healthy way. You have peer support, depending on what type of group you're in. Maybe it's people who have gone through something similar that you have gone through. You have reduced feelings of isolations, installation of hope. I don't want to get into Yalom's 11 universal theories because we'll go into that in the next video. You have a safe environment to express yourself. It's less costly. You're able to play a variety of roles. You combat your isolation. It allows for role monitoring and interpersonal learning. You have group norms. You experience social support. You learn in a social system. Some of the benefits of some of the goals are that you are able to learn how to trust yourself and others. You are able to have self-knowledge. You recognize the commonality among your group members. You find alternatives to resolving conflicts, increase self-direction, learn more effective social communication skills, become sensitive to other people's needs, learn how to confront appropriately, clarify expectations, goals, and values, and all of that good stuff. So groups are really good. Let's talk about how many different types of groups there are. So there are several different types of groups that exist, and for several different purposes, like eating disorders, diabetes. Diabetes could be a group. You have for any type of disorder really, or just like grief that you're going through something, or a training, like that is a group session as well. So there's many different types of groups. I have seen questions on my practice tests that say like, out of these, which could be a group, and then it'll be a bunch of different ones and then all of the above. And usually for me, it's been all of the above. But let me just go through briefly the list of that I have here. So first we have guidance. So guidance, think like guidance counselors. They're trying to guide you towards something. So this will usually be a group that's done in a school setting and they're trying to guide you to like your future, right? Then you have counseling groups. Now, counseling groups are different from psychotherapy and psychoeducation groups. Those are all three different. They do not go hand in hand. So counseling groups is for people who are sought out counseling and they were recommended group therapy. So say, for example, you have somebody who is experiencing grief, and I'm just thinking that's the first one that came to mind. You want to send them to a grief counseling session. That would be a counseling session. They're focusing on removing blocks, barriers, and prevention. They're trying to address a specific problem in a group format. Next, we have psychotherapy. So these psychotherapy, always think like it's long-term. So this is going to be for people who are impatient, have serious mental health issues that need to run longer than other mental health agencies. These could also work on private practice, and the focus is remediation, treatment, and personality reconstruction. Then we have psychoeducation. So these are learning groups. It's where you learn how to do something. So let's say, for example, psychoeducation could be like a parenting class. That is where you're learning how to fix your child's behavior or how to be a parent who does this and that. These focus on acquiring information, skill building. They can be preventative, growth oriented, or remedial. One of the other ones that was there was like for battered like spouses to go to these sessions and learn how to communicate better. So psychoeducation, educating. Then you have structured groups. So structured groups are most often closed groups, and there is a difference between closed and open groups. Open groups are anybody can come in at any time, anybody can leave at any time. Structured groups are closed groups, and that means that once we start, like, we're closed and nobody else can come in. Usually group members are like 7 to 8, magic number. And these structured ones focus on a central theme. So they are not like we can sit around and talk about whatever. We are here to talk about this specific thing. That could be either anger management, drinking and driving, learning how to seek job skills, loss and grief. And then we have self-help groups. So another question I've gotten is which type of group would be able to manage without a therapist? That would be self-help, because they usually involve a single issue as well. They are led by a survivor who has overcome the problem. They're focused on issues such as weight control, survivors of incest, parents who have lost a child. They're usually not professionally led. You then have groups. These are training groups. So at work, if you ever need to do a training and you're doing that with a group, that's a T group. And then you have task and task/work groups. So these are committees, planning groups that focus on a specific task. So they're trying to get something done. Those are all the different types of groups that are on this book. Let me check the other book. Nope, that's it. So we're going to next talk about the leadership styles and the roles within the group members. Yay!